We're proposing to change children's surgery and anaesthesia services across the region, and we want to know what you think. Over the last 2 years, we've reviewed our services and found that if a child needs an operation, they will have a different experience and receive different standards of care depending on where they live. Our doctors, nurses, healthcare staff and clinical experts have all agreed that this isn't fair, and we've come together to change it. You also helped us with our review by telling us what would be important to you if your child had an operation. Your feedback was then used to help us develop our options. You said it was important to receive safe, caring, quality care and treatment, have access to specialist care, be seen as soon as possible, have care close to home but are willing to travel for specialist care, have appropriate facilities for parents and carers with excellent communication when a child is in hospital. So which services do we mean? If a child needs an operation under general anaesthetic, at night, at the weekend, or if they need to stay in hospital overnight for a small number of services, we are proposing they are done in a different way. The services we are proposing to change would be ear, nose, throat, general surgery, ophthalmology, oral surgery, orthopaedics, and urology. For most services, nothing would change, and you would still go to your local hospital. We are not looking to change specialist services for children with very complex or multiple conditions, and you would still go to Sheffield Children's Hospital, as it's the only specialist children's centre in our region. Our changes would affect 1 in 7 children needing an operation in South Yorkshire, Mid Yorkshire, Bassetlaw and North Derbyshire. Why do we want to change these services? Some of our hospital doctors and nurses don't treat as many children as others do. Why is this an issue? Children are not small adults, and if they need an operation, it's best and safer for them to be seen by a surgeon who is trained and regularly operates on children. Nationally, there aren't enough healthcare professionals qualified to treat the amount of children who need surgery every year. That's why we need to work with the staff and resources we have locally, to make sure our region's children have the best possible, high-quality care. Our proposed changes are not about cutting services or saving money. By making changes to how children's surgery and anaesthesia services are currently provided, we believe we can better share skills and knowledge to ultimately provide a much better, equal service to every child in our region. How did we develop our options? We looked at a number of areas, including whether a patient can get to hospital within 45 minutes, the number of children needing operations, the effect of changing services on all our hospitals, what our patients have told us, how many people we have working in the services. There are 3 options we would like your views on. Option 1. Children's operations for services we want to change would no longer be provided in Barnsley or Rotherham hospitals. Instead, you would go to Chesterfield Royal Hospital, Doncaster Royal Infirmary, Pinderfields General Hospital in Wakefield, Sheffield Children's Hospital. Option 2. Children's operations for the services we want to change would no longer be provided in Barnsley, Chesterfield or Rotherham hospitals. Instead, you would go to Doncaster Royal Infirmary, Pinderfields General Hospital in Wakefield, Sheffield Children's Hospital. Option 3. Children's operations for the services we want to change would no longer be provided in Barnsley, Chesterfield or Rotherham hospitals. Instead, you would go to Pinderfields General Hospital in Wakefield, Sheffield Children's Hospital. We prefer option 2. With careful planning to make sure we have the right staff in each hospital, and by working with our ambulance colleagues to make sure that patients could get to hospital within 45 minutes, we believe option 2 would give all children needing an operation in South and Mid Yorkshire, Bassetlaw and North Derbyshire access to the same high-quality surgical services that they deserve. Which option do you prefer? Let us know by visiting the website or calling us for more information.